I'm going to call the meeting to order. The minutes, excuse me, the minutes from June 27th are in your information. Get a motion on that, please.
Move approval.
Second.
Okay, I don't know how that happened, but
However.
yes. All in favor?
Aye.
Opposed, same sign. Dr. Anderson, the medical staff meeting.
Yeah, so I have a couple med staff meetings to report on. One from July 12th, and our most recent one from August 8th. So, like usual, we have a lot of items on our agenda, so I'll just try and keep it to the more relevant things that I thought you might be interested in hearing about. Starting with the July meeting, at that meeting, Tina Holdsworth, who's our Director of Public Health, Home Health and Hospice, she reported that there was a discrepancy on the Medicare Compare website with regard to some of our hospice care data. Apparently this is a website where different agencies can be compared, and one of the measures on the website with regard to hospice is are the nurses or the social workers seeing the patients within 2 to 3 days of the end of their life. And on that website it indicated that for Myrtue, those patients were only being seen 10% of the time. So the reality is they were being seen 92% of the time. And so Tina has looked into that, and they figured out where the discrepancy was as far as the data reporting, and that has been corrected or will be corrected. Some of our competitors were using that data to elevate themselves and try and, I think, show that we were providing less than ideal quality of care, but that actually is not the case. So I think our hospice agency here at Myrtue does a good job, and the data should reflect that here in the near future, if not already. Kim Burchett reported to us that we've been receiving some notifications from CMS that we're underutilizing what's called chronic care management. This is kind of part of our ACO that we've been a part of now for a while. Some of our patients who are a little sicker, who have multiple chronic medical problems, who may need some additional care beyond what they get at the typical clinic visits, they can be put into this chronic care management services category, and our health coaches can contact them on a more regular basis and just kind of help them with some of their medical needs. And apparently this chronic care management program available to us has been underutilized, so we're working in the clinic to utilize that better for the benefit of our patients. There was some discussion at the staff meeting regarding these mail order pharmacies, which many people are using now for their meds. As you know, there were concerns about strikes. I think it was UPS and possibly the U.S. Postal Service as well. I don't remember some of those details, but there were serious concerns that patients may not be able to get their meds because of these delivery services. I don't know, I think some of that has been worked out since we had this discussion, but there has been concern about that. Of course, we received an update on recruitment. I think Barry and Jill are going to talk more about that, so I won't elaborate further. We continue to educate the medical staff regarding the Tiger Connect. It's the HIPAA-compliant messaging service. I think it's been good. We're expanding all the things that messaging service can do with regard to on-call provider schedules and those kind of things. So the med staff is receiving education on that. And then Jenny Lefebvre talked about the move of the emergency department from where it's been for the last decade to where it currently is.
Is that transition going well?
Yeah, I think it went real well. The actual move happened on July 6th, and there have been preparations, of course, for the move for a while, but that was the actual move date, and I think everything went well. So it's the quarters are a little tighter, and it just has a different feel to it than the previous emergency department did, but it's going to work just fine, I think, until the new facilities are ready to go. So moving on to our August 8th staff meeting. We reviewed the ACO results, the quality measures, and I think Laura's going to report on those here a little bit more. Our med staff continues to do very well with these quality measures. We've made a lot of progress over the years. So there's really only positives to report there. Karen reported to us that our infection prevention committee is considering reinstating travel screening questions. So you may have heard there are some diseases which we typically see very rarely in this country, if at all. Hansen's disease, which is leprosy, malaria, and a fungal disease called Candida auris. These are all diseases which are in this country and even in neighboring states. I'm not sure if any of them have been actually identified in Iowa yet, but there's expectations that they will be. So just like with some of the other infectious diseases in the past, Ebola virus, COVID, there for a while, part of what we do is we ask certain questions when we see people, new patients in particular, come through the ER and the clinics to try and screen better for some of these new diseases which could enter Iowa at any time. So our infection prevention committee is working on some of that stuff. Kim Burchett reported on HCC coding. So HCC coding has to do with higher priority coding. So there's a difference between a cancer diagnosis and a diagnosis of high cholesterol. And so it's important for us to, at least once per year, code these higher priority diagnoses. It helps Medicare understand that our patients are more ill, and actually more money is allocated to take care of those people with higher priority codes. So the medical staff continues to receive education and encouragement in that regard. Again, August 8th, there was some discussion about recruiting, which you will be hearing more about. There's been some new developments with MyChart, so we can do video visits now through Epic's MyChart, which is something new. Zoom will probably be used less and less, and the new application for video visits through Epic MyChart will probably take priority in the near future. Patients also can direct schedule, so a lot of us now have blocks on our schedules where people can actually go through MyChart and schedule themselves. So there's this continual move towards giving patients more freedom to manage their own health care, which is ultimately a good thing. So I think that's all I had as far as highlights from those two meetings. Does anybody have any other questions for me?
Have you been doing a lot of Zoom visits?
You know, that's definitely dropped off since we've gotten on the downhill slope of the COVID pandemic, but yes, we still do those from time to time. I have patients in other parts of the state that rather than establish care there, they'll still just sign in and have visits with us. So it improves flexibility for patients.
That's great.
Okay, thanks, Brian. Next up, quality improvement report, Laura.
We had our last system-wide QI meeting in July, and 13 departments reported at that meeting, so I'll just review some of the highlights. Behavioral Health reviewed their satisfaction survey results and are developing all new QI goals for the new fiscal year, which are great. Cardiac rehab monitored goals assessed on dismissal, and 100% of their patients reported an improvement in their status. For credentialing, 100% of the physicians and CRNAs that were reviewed had the network review completed. For diabetic education, they had 17 patients referred to them for the quarter they were reporting on. They look at their hemoglobin A1Cs and want that to decrease. Their average was a decrease from 8.9% prior to education to 6.3% for their A1C. So that's really good results. For the emergency department, we had 3 patients present with a heart attack, and their transfer time was an average of 26 minutes. A new measure for the ER is looking at patients' arrival to provider assessment time, and that average is 16 minutes, which is also really good. They remain 100% at transfer communication. Medical records looked at and reviewed ER documentation, and 90% of that was reviewed in the appropriate time. Lab reported on proficiency testing compliance and blood usage. Nursing infection prevention is collaborating with the surgery department for surface testing, and they also reported the new interface for Epic with Bugsy, called Bugsy, is providing really great data. It's real-time data. We can look at any infections in real time, and that has been a really great interface and is still working well. Rehab services reported on fall screenings, and we'll be adding a new layer to that for their new quality measures for the next fiscal year. Dr. Anderson kind of reported a little bit on the ACO measures. There's the 10 quality measures: breast cancer screening, colon cancer screening, fall risk, and they look really good. The clinic is doing a great job on those measures. The specialty clinic monitored after visit summary and hand hygiene, and then surgery reported on that they had no post-op blood clots, no post-op sepsis, and compliance with surgery and tissue review requirements. So that was all the departments that reported.
Any questions for Laura? Thank you. Personnel committee report, Jim?
The Personnel Committee met this morning. There were 3 initial appointments, 15 reappointments, and 1 expansion of privileges, and 3 voluntary withdrawals. I would make a motion to approve those appointments, reappointments, and expansions.
We have a motion from Jim. Second, please. Second. All in favor, please say aye.
Aye.
Opposed, same sign. Barry, we're already ready for you.
All right. Well, I decided I wanted to kind of give you a written report moving forward, and that was sent out to you earlier. So I may not go over all of this at the board meeting, but at least it's there for you to read if you want to. And kind of starting out with the physician, kind of specialist, physician recruitment areas. And it may look like there's a lot going on here. I don't know if this is terribly out of the ordinary, though. We're always focusing on areas, specialties where we need to bring in new folks. Starting with behavioral health, we did have Dr. Larson start here in July. She's 16 hours a month. She'll oversee our APPs as well as do some med management. She replaced Dr. Dean, who's been working with us for quite some time. And then, the school contract that did end, the school-based therapy contract did end July 1. So a couple of those therapists have come back to our office, our behavioral health office. So Rhonda Anderson is back in our office. Katie Sandquist has been back for quite some time, probably at least a year. We did hire Andrea Terwilliger, who has started behavioral health therapist. And then Amanda Sumner is APP that will be starting here in September. We have made a few policy changes to kind of tighten up our no-show policy to try to get we're always trying to reduce our backlog of patients in behavioral health. So this policy change should help in maybe getting those patients in that really want to be seen. So make it a little bit harder on those that don't show to stay on the schedule, I guess. So that's always an area that we're working on. Orthopedics, we'll have a big change here in about a year. Dr. Vase will be retiring a year from now. So Miller Ortho, they're working on recruiting his replacement and have been for a little while now. Dr. Ricard, he just came here once a month. Spine surgeon, really hadn't done hardly any procedures actually. But he moved away, and so we don't have him coming out after, I think his last clinic was in July. And then also our APP, Shania Scholl, has resigned, and we're looking at whether we should be looking at hiring somebody ourselves into that clinic. They're also looking at replacing her as well. So those are some things going on with orthopedics. Oncology, I know we've talked about this a lot. We're down to basically one day with Dr. Hussein, 1 day per month. It's telemedicine. We think we could easily accommodate 1 day a week. So this is an area we've been working on for quite a while and trying to find additional coverage, additional oncology coverage. So there's a couple of practices in Omaha, Oncology Associates. We have talked to them. They're considering a potential outreach here. Another potential group that we could talk with would be Nebraska Cancer Specialists. They're developing more of a relationship with Jenny Edmondson in Council Bluffs. So that gets them a little bit closer to Harlan. And we've also talked with U of I for a potential telemedicine outreach oncology clinic as well. So doing a lot of legwork right now with those areas. Ophthalmology, we have added Dr. Thornton. Her first clinic was in in June. We'd like to get her actually out here a couple days a month, but we wanted to start with 1 day per month and see how that goes. Dr. Liu continues to come out once per month. Endocrinology is another area where we have kind of a little bit of a backlog right now. We did get Dr. Anna Curry to increase from a half a day to a full day per month, so that will help with that. But we've also talked with U of I about a possible telemedicine endocrinology clinic. I did put hospitalists on this. This is just really something we're trying to educate ourselves on. So we've talked to some different vendors on what hospitalist coverage could look like. So this would be inpatient, physicians that are completely focused on inpatient care. Karen and I have talked with, I think, 3 or 4 different vendors now. So that's really just educating ourselves for the future, if that's the direction that we want to go. As far as family practice goes, I'm going to let Jill talk about Dr. Natalie Francis, and I'll just turn that over to you.
So we wanted to provide the board an update on where we're at with recruitment efforts of a family medicine with OB, given the transition of Drs. Barelji and Hylison to the ER. So we first met Dr. Natalie Francis in May of this year, and she is a family medicine resident with obstetrics, and she is currently entering her 3rd year of residency at the Family Medicine Residency Program in Tuscaloosa, Alabama. And we've been in contact with her ever since May. She had the opportunity to visit our practice, meet with our medical staff, kind of experience the community. In June, over Father's Day weekend, she brought her spouse along with her, and she has since accepted an employment opportunity with Myrtue and Shelby County Medical Corps, and she will be joining us in September of 2024. So we're really excited about that and her choosing Myrtue as her place to practice and this as a place for her and her family to call home. They've already been in contact with a realtor in the area, so they're getting serious about this, and we'll stay in contact with her over the course of the next year while she finishes her residency program. She's on her OB track, so she'll have some deliveries under her belt. We know we're going to have to do some proctoring of her in the line of C-sections when she arrives, but looking forward to her providing that service when she arrives.
And while that was all going on, we were also looking at a second family practice with OB candidate. And we did have a visit with her in August, and she's actually got out of her residency in 2020, has been practicing for 3 years, has delivered over 200 babies. She's kind of in a rural area, or kind of a remote area of North Dakota. We're still working on that one, so I'm not going to provide a lot of detail on that at this point. But the visit went great. I had nothing but just great feedback from everyone that met with her. So we're going to continue to work on that. We're also looking at hiring either 1 or 2 APPs to increase our weekend coverage as well as our weekday extended coverage. And I'm hoping to have some announcements on that here in the next week or so. Can't really say anything about that yet, but like I said, hopefully we'll have more information for you on that soon. So moving on past recruitment and physician providers, we did have our results. So we moved to a new Medicare ACO effective January 1 of 23, the Caravan ACO. But prior to that, we were with Harlan Health Alliance ACO, and it always takes them about 8 months to get the results from the previous year. So we did just get those results from the 2022 year, and we didn't have any shared savings, which we knew that was going to be the case based on the preliminary reports and everything that we had seen leading up to that point. We didn't get any shared savings out of that ACO, so I guess financially we didn't really meet our goals, but there was a lot of really good work that was done as a result of being a part of that ACO, improved operations, improved quality metrics, and we're seeing that now with the new ACO that we're in, because we're in a pretty good place when compared to some of the other hospitals that are in that ACO, and that wouldn't have happened had it not been for the ACO, the Harlan Health ACO that we've been involved in for the last 3 to 4 years. So we're moving on. We're now in the new ACO. Laura gave you some information on how we're doing there earlier. We also are going to be working with Medicare Advantage ACO. The company that we're working with is Main Street. We don't have any risk. It's a different arrangement. We have no risk with that. We should generate about $100,000 in additional revenue as a part of being part of this program. Plus, they're going to provide a navigator that will be completely paid by Main Street. A navigator that kind of helps those Medicare Advantage patients kind of maneuver through the system. So I think that's going to be a good addition moving forward. Medicare Advantage plans have been more difficult for hospitals to work with. There's a lot of denial of services that happen with Medicare Advantage plans. The payment is more difficult to collect, more denials. So and this is known nationally. The Iowa Hospital Association, they're focusing a lot more on trying to make these Medicare Advantage plans more accountable. That's one of their focused areas, strategic areas this next year. But we also know that they're here to stay, and we're going to need to try to work with them. So I think that this arrangement, this partnership with Main Street will help those patients that have chosen to utilize a Medicare Advantage plan as opposed to a Medicare traditional plan. So that'll start in January 1. I think I'm going to talk quite a bit about ambulance services. The MIWA, we continue to work, the Multi-Employer Welfare Association, we continue to work with the 8 other RICHA hospitals on pooling our health insurance together, and that will go into effect January 1 of 24. Again, the goal there is to try to kind of stabilize those health insurance increases that we see each year. We've actually done pretty well with our increases the last few years, but historically you can, every other year you can see some pretty big increases when it comes to health insurance cost. So we think that will help stabilize those increases. The next item there, the Iowa Hospital Association does an economic impact and a community benefit report each year. It used to be 2 separate reports. They've combined them now. The economic impact report looks at the number of jobs that we have here at Myrtue, the amount of total wages here at Myrtue, and then they make the assumption, obviously employees here spend money in the community, so they have this multiplier that they use to determine what the total economic impact that Myrtue has on our community in Shelby County and the surrounding communities. And the impact is 900 jobs. So basically, if Myrtue didn't exist, 900 jobs would go away. $38 million in wages would go away. $85 million in expenses. So that's part of this report, this combined report, the community benefit. We have about $1,947,000 in community benefit. That's really just bad debt expense, charity care, and Medicaid losses is really all they're looking at. They kind of changed that report a bit from a few years ago. Really just looking at those 3 areas now. And they're showing over 4,000 people served by Myrtue Medical Center during that year. So this is used a lot with advocacy efforts that the Iowa Hospital Association, ongoing efforts in that area. And I think it's pretty compelling information. Obviously, our purpose here is to provide health care to our patients, but this is a pretty important aspect of what we do as well. The economic impact that our hospital provides to the community is pretty immense. So, any questions on that? We are starting the master facility plan project. I talked about that over the last year. Right now we're providing a lot of the data that is needed for them to do this project, this evaluation. So information on number of beds, number of exam rooms, number of visits, patient days, procedures, those types of things. So they're gathering that information, and we'll be setting up some meetings with those departments over the next 2 months to meet with the architect and the construction manager. We did add, the focus is going to be on the rural health clinic, but we've got surgery and outpatient specialty clinic we want to look at as well. But we're also going to look at our med-surg unit. We did add that. really think that we need to be looking at that area as well, and don't want to, while we're in the process, it makes sense to look at inpatient as well.
How long will that take to complete?
I think about 2 months. We should have something for you, I would hope in December, January timeframe. So, and it's really, it's just a high level look at our facilities. It's not, they don't get into any design work, very high level, and then bring it back to the board and we decide how to move forward at that point. I think maybe I'll let Jeff, there's a lot of stuff on facilities on this report as well. We've been very busy. Maintenance, facilities has been very busy, obviously the ER project, but I'll let Jeff talk about the rest of this report.
So over the last few months, this is a kind of a list of what has been accomplished and what's a few things that are coming up in the near future. The gift shop has been being worked on for a couple months, and if you've walked in the front entryway now, yesterday the new storefront was put in. They've been putting cabinetry in for the last 3 or 4 days. We also were at the same time taking the opportunity, since we had to replace carpet in the front, we've replaced the carpet all the way down the hallway, updated the lighting, really has changed the look and the feel to that. This upcoming weekend we'll finish the flooring inside of the gift shop and what's called walk-off carpet, which is in the entryway. So a lot of work is being accomplished here real quickly. And hopefully in the next couple of weeks, we'll be ready to have the gift shop move to their new space. Then at that point, we'll go into that older space, work on the coffee shop, and get that up and ready to go. And hopefully in the next couple of months, we'll have all that. The one thing on the gift shop that they came and measured for the countertops, the work surfaces. So I'm told that's about a 3-week process. We're hoping, we said, what do you have in stock that we could get quick? So hopefully it'll be a lot faster than that. Emergency department, as you see as you drive up, is a lot of work going on there. Inside, you won't really recognize what is in there anymore. A lot of the walls are down. It's all been, for the most part, demoed. Steel work is going to start inside there possibly today. Also today will be a backhoe to come in and start working on the footings and these storm and sanitary sewer reroutes. As I mentioned here is one point or a challenge, that 8-inch sanitary. The plans that we had showed it was 6-inch, and with a 6-inch sanitary you can put elbows in, move it around wherever you want, and as they had dug up they realized it was an 8-inch sanitary, which has different requirements. So we had to have a slight change control on that because that requires manholes instead of the elbows. So manholes will arrive tomorrow and the work will continue on that. So that's, things are going very well there. We're still on target for August of 24 completion date. They're also coming up in November as the last piece of steel that will get mounted. We want to have a signing. Now we're working on that to have employees and the board members here come and sign the girder, and that'll be the last piece that goes up there. So more info to come on that once we get more scheduled. We worked on head walls. We ordered some new head walls for a number of rooms. 301, 302, and 234 are all complete. The OB required bringing up all the med gases to code, so there's a little bit of additional work that needed to be done there as we started. And also as the mounting of the head walls, we had to take the sheetrock off, put backing in, refinish the sheetrock, reroute some electrical and the med gases and put all that back. So we have 3 more to go. We're going to do 212, 226, and 303. Satellite clinics, we had received a grant of $100,000 per satellite. So some of the work that we did, we added on all of them, all new security systems for door access and video security. They had, none of that was at present. We have 2 cameras that aren't working right now, so we're working through that. So everybody now can use their badge to badge into the doors, and then we've got tracking on who was there, who wasn't, when were they entered, and so on. And a number of them got, two of the sites, Shelby and Elkhorn, got automatic door openers, so you go press the button, the door opens up. Lots of all new lighting throughout all the clinics, all new networking equipment to speed up their connections, hopefully make things a little quicker for them. A little painting here and there, some storage was added to a couple of them, so lots of work had been done there. We also had finished the nuclear medicine, which has gone really well. The MRI truck, as part of the ED, we moved its location from next to the ambulance garage to just south of the central utility plant and added a door coming out of diagnostic imaging, so instead of walking through all of the emergency department outside in the rain, they can just go straight out the DI and they're right there. So and then in OB, the floor got all new paint, so pretty much the entire OB section was painted. Well, as part of the work we had to do with the med gas, we had to cut some holes in, so they all were repaired and such. So it's got a fresh look, and next fiscal year we'll look to replace all of the carpeting in that area. Lighting, as we're going through the front hallway, it really brightened it up, so we're starting to look at upgrading like all of these lights here. It's about $55 a light to put new LED panels in, cost savings on electricity, it's brighter, kind of changes the whole look. So we have 80 of the lights on order that we will be replacing throughout the hospital, in the next year or so also. Behavioral health is part of the additional staff that is in the building. We added one more office, or we're able to put up one wall to accommodate another office. So that's be a good addition. The new education rooms down in the basement used to be the computer lab. We've converted that to an education room, along with a storage room behind it is their testing area. So now they can accommodate quite a number of people, some receiving education, some taking their tests simultaneously. So good addition there. And the last is the elevators. The west elevator is all complete and has a nice new look and feel. It's still 50 feet per minute, but the east one here, just right outside, or closest here, will be started sometime here in September. So just a long delay. We actually approved that project in February, a year and a half ago. So it'll be nice to get all of that done. So any questions on the projects that have been going on the last few months?
Did you skip central utilities on purpose?
Maybe.
It's your favorite.
Now, central utility plant, we do have, the punch list is essentially complete. The last thing we have to do is there's a regulator. The synthetic natural gas has a 5-pound pressure, needs to be down to 2 pounds. So a regulator is going to be put on tomorrow, and then after that we'll test it, validate the system, let it run for about a week, and then the city will come and move the meter, and then that project should be essentially 100% complete.
You've been busy.
Yeah, I'm not sure he sleeps.
Yeah.
Are we feeling good about the screen? I see the scaffolding's down and
Yeah.
all around the children.
The-
Looks like that's done.
For the most part, yes. The screen is not 100% straight. You can't put a line up there straight down, but it is a lot better. The paint job, I've talked to the painters out there. They did sandblast everything, prime it all, and then repaint it. And what happened before was they primed the full sheets of metal and then stamped them, and then didn't bother priming where the stamps were. So there was an issue that had started to appear with that, and the manufacturer admitted, and they paid to have it all refinished and completed. So
Thank you.
Thanks, Jeff.
The elevator project that you're going to do over here, did
Yep.
the price increase, or is that a straight bid thing?
it was straight bid. They have pushed a change control with a slight price increase for some stainless steel that wraps the outside, and I'm kind of arguing back to them, as you said you had these ordered a year ago, I shouldn't have to pay an increase. So But the total change control and price increase was $6,500.
Pretty good.
Yep.
Can I ask one more question? Where did the grant come from that we used for the rural health clinics remodels?
It's part of the emergency hospital and rural health clinic grants related to COVID.
That's a nice upgrade to this place.
Yep.
Yeah.
Yep. All right. In your packet is the list of the naming depositories. Looks like you need to have approval on that.
Yeah, so we're just updating for more flexibility. The only increase there was Huffman Coney, brought them up to some of our other investment companies there, the $6 million, so it just allows us a little more flexibility in where we can invest our funds. That's the only change.
I'll make a motion to approve those depositories.
Jim made a motion. Get a second, please.
I'll second.
Second, all in favor?
Aye.
Aye. Opposed, same sign. Okay, Christie, the monthly financials.
So the condensed financials are up there for the month of June of 2023 and 2022 to do the comparisons there. You can see we were down a little bit in outpatient visits for 4,993 visits in June of 2023. We had 416 visits in our ER and 124 surgical procedures. Physician clinic visits were 3,351. Outpatient behavioral health visits was 1,279. So a pretty majority of those are down a little bit. We had a lot of vacations in June and summer always slows down a little bit. Average daily census, we really took a dip in June on our average daily census. We were at 6.19. Last year we were at 8.4, so we really did see a dip there in the month of June. We had 3 births, 4.5 million in operating revenue, 4.8 million in operating expenses. So operations, we had a $292,000 loss. We did go ahead, we already have our IPERS adjustment. It is a $2 million positive adjustment. We expected a negative adjustment, but we've come to explain from our auditors that those fluctuations in those markets are amortized over several years. So you don't see, if markets are really good one year, and you don't see that big dips and valleys. It's more evened out, which, in all the years they've been doing this, we had not heard that explanation before. So because the markets were down in June of 2022, we'll see kind of that gradual decline probably over the next few years of that. But that was a positive $2 million adjustment. We had our non-operating was $541,000. So all sources with that adjustment was $2.2 million. Last year was 1.9. So if you look to year to date, our outpatient visits are up 5.9%. And that was all outpatient, whether it's a lab, radiology, respiratory therapy, the outpatient specialty clinic. So we had 58,196 visits. Emergency room visits, we had 5,669 for this year to date, which is a 0.5% increase. Surgical procedures, we did 1,385, which is a 5.2% decline. Physician clinic visits, we had 43,243 patients come in through the clinic, which is a 4.2% decline. Behavioral health had 16,007 patients come through, or visits come through, 3.8. We were at 9.08 average daily census, which is down 8.7%. We had 91 births this year compared to 81 last year, so it's a 12% increase. 52.9 million in net operating revenue. Net operating expenses was 53 million. So we had a $427,000 loss from operations. We had budgeted for a $535,000 loss, I believe. So we came in a little bit better. IPERS adjustment there for this month Net operating others for property taxes, investment earnings, those type of things is 2.8 million there. So we had almost a $4.4 million from all sources this year compared to a $5 million last year, which is about a 13% decline. Now, these are unaudited numbers. The auditors are coming in next week. They'll be on site for 2 days next week. And they pretty much have all of our data. So we should be able to finish that up pretty quickly and get the only adjustment we're anticipating possibly would be if there's a due from our cost report for Medicare, which the auditors always take care of that. But other than that, we are hoping to have 100% clean with no adjustments.
Good.
So we did do the 4-year comparison again. We're kind of seeing, we're getting past 4 years past that year that we had COVID. So you don't see us, you should be seeing it pretty well get better or stabilize anyhow here, which we are seeing there, that we can see in 2020 how visits were lower there, and in 2021 they were just a little bit slightly more there, and then we continued to increase from that point on. I've just had some physician clinic visits for the Real Health Clinic. We've just had some providers out sometimes in this last year, so that's really the big change there. Average daily census, you continue to see that go down, and it's generally in that acute and swing bed. Just swing bed, they want them in nursing homes. The Medicare Advantage plans definitely want them in nursing homes, and it's, as Barry said, it's very difficult to get a patient on a Medicare Advantage plan and it's acute. They want them as observation because it's cheaper for them. So we really get a lot of pushback for that. So births we see continue to grow. We saw that dip after COVID there, dip from 68 to 50 to 81 to 91. So we are continuing to see that grow, and our revenues do continue to grow, and our expenses, of course, continue to grow. But really trying to keep them pretty consistent there so that we still have a strong financial. We still have quite a bit in investments that we'll use up for the ER project and continue to have a strong cash flow and assets, and not any really liabilities other than operating liabilities, no bonds, no loans, no anything like that. So
Can I ask what the 8.4 million in long-term debt is on the financials?
which,
On your balance sheet?
okay.
It was 290 last year, it went to 8.4 this year.
That's part of that IPERS adjustment. It has to do with, and I can't really explain it all, but it has to do with the IPERS adjustment as to basing it right on the market, right at the time they did this actuarial survey, what we have a liability for our employees to pay out in the future based on what it is right now. So it's a projection of basically what the market is short, what their investments are short of being able to pay out the benefits for. So, and that's where you can see that the market was so much down in 2022 compared to previous.
It
So,
really struck me when I saw that, I was like, I didn't,
yeah,
yeah.
so it's kind of like, yeah, that's what,
Do they have a different description for that on the audit report? Wonder if
That's
that's,
a good part of mine, too.
because that's required as well, but anyway.
I can double check that. There are a couple descriptions I want to change to match better with the audit report, and that might be one of them that I'll catch too.
Any other questions for Christie on the financials? Can I get a motion, please?
Move approval of the financials.
Motion second.
I'll second.
Thank you, Jim. Motion and a second. All in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Payroll claims for both June and July provided in your package. Two separate motions or one?
One is fine.
One,
I
okay.
move the approval of the June and July payroll claims.
Okay, thank you, Terry. Have a motion on those. Second, please.
I can second it.
Motion and second. All in favor, please say aye. Opposed, same sign. Motion carries. Okay, I guess we are ready for an adjournment. Motion,
I move to adjourn.
thank you, Terry.
I'll second.
Motion and a second. It's time to go.
How about a shout out to the auxiliary bazaar coming up on the
Yes,
14th?
yeah, right. The bazaar is the 14th of September in the Vets Auditorium. Seems early this year. Yeah, all right.
And kudos to them for their pop-up sale
Yeah,
last
that was
week.
kind of fun.
Last week, 2 weeks ago?
Oh, that was fun.
Last week. Yeah.
Did you get some Christmas shopping done then, Terry?
I missed it.
You got your gift.
I was encouraged to Christmas shop. I was
He is
encouraged, but I
amazing.
didn't. So.
Oh, all right.